A comprehensive guide to prevent measles outbreaks in developing, underdeveloped, and fragile nations. Why measles vaccination is important. Measles is a highly contagious, acute infectious disease typically caused by the measles virus. It is characterized by systemic symptoms such as fever, malaise, and lymphadenopathy, followed by a maculopapular rash and respiratory manifestations. In addition, the disease may lead to potential complications such as pneumonia and encephalitis that can cause serious health complications and even death. Despite the availability of a safe and effective vaccine, measles outbreaks continue to occur in many parts of the world. Fortunately, there are steps we can take to prevent the spread of the virus and protect our families, communities, and countries from an outbreak. We will provide insight into how to monitor for cases of measles, tips on boosting immunity through vaccination, and recommendations for limiting the spread of infections. Cause of measles outbreak? Poor vaccination coverage is a phenomenon that has been documented in many countries around the world. It is defined as a situation where there is inadequate uptake of recommended vaccinations within a population. What factors are contributing to poor vaccination coverage? A. Operational factor. First, poor measles surveillance and poor reporting systems are a major cause of preventable deaths and illnesses around the world. Without adequate systems in place, it is impossible to accurately track measles cases, identify high-risk areas, and provide timely and effective interventions to prevent further outbreaks. Second, the prevalence of substandard healthcare infrastructure for vaccination is a complex, multifaceted problem that can be attributed to a range of contributing factors. Third, poor vaccination microplanning or inadequate approaches to vaccine and logistic delivery at a session site level. B. Communication factor. First, vaccine refusal or vaccine hesitancy is a phenomenon that has become increasingly prominent in recent years. Second, low level of coordination among partners and stakeholders, poor mobilization and monitoring. Third, a lack of community engagement for vaccination has resulted in a significant lack of public understanding and receptivity towards immunization. How to respond to the measles outbreak? First, coordination, for example, government, World Health Organization, UNICEF, and assessment of the surveillance data, and identify measles hotspots. Second, notification of an outbreak and deployment or activation of the rapid response team. Third, microplanning and finalization of vaccine and logistics requests for the measles vaccination campaign. Fourth, start a measles vaccination campaign to ensure that all targeted populations are covered within the time frame. Fifth, ensure proper waste management to avoid misuse and contamination. Sixth, document the best practices and explore if these best practices can be replicated in the immunization program. How to prevent further measles outbreaks? First, early detection. By utilizing epidemiological and surveillance data, healthcare professionals can identify potential outbreaks and initiate preventative measures to curtail their spread. Second, strengthen measles surveillance, improve the informer network, and ensure adequate and timely reporting of cases. Third, improve microplan and ensure separate vaccination plans for refugee camps, hard-to-reach areas, underserved areas, and low vaccination coverage areas. Fourth, strengthen routine immunization services and increase routine immunization coverage by ensuring zero doses and refusals vaccination. Fifth, tackling vaccine hesitancy through proper communication strategy and ensuring better coordination among the partners and stakeholders. Sixth, social media initiative. Utilize social media platforms and involve social media influencers and YouTubers. 7th, develop localized communication materials endorsed by prominent local doctors, religious leaders, educational institutions, and civic societies. 8. Conduct monthly immunization task force committee meetings and media debriefings to avoid any negative news by the media. Conclusion. The best way to protect ourselves and our communities from the spread of this highly contagious virus is through vaccination. Vaccination is the most effective tool available, as it protects individuals and health.